Then, a few months after that, I tried something on Mary because I was working with Mary. Mary is the first case in TFT. She suffered from an extremely severe phobia of water. I've never seen a worse phobia than Mary's. And it was extremely intense. She had nightmares several times a week. She was in her 40s at the time, and she had had this as far back as anyone in her family could remember. Since infancy, she was absolutely terrified of water. Nobody knows why. So I explored her, I was talking with her, and I tried this. I made sure she wasn't reversed, because I knew about that, but I didn't know anything else. And so I pushed on her arm, asking her to think of water, and when she touched here, the arm was strong, which indicated to me that this meridian for the stomach was out. She also put it this way. She said, I always have this horrible feeling in the pit of my stomach. So I said, well, let's try something. The stomach meridian, of course, begins right here, comes up around, ends up on the second toe, goes over the whole body. So I just asked her to tap right here while she thought about water. And she did this, and her expression changed dramatically. She looked at me and she said, it's gone. I didn't know what she was talking about. I wasn't expecting anything, of course, nor was she. And I said, what's gone? She says, that awful feeling in the pit of my stomach when I think of water. It's not there anymore. It's gone. Well, I was very skeptical of this, of course, because I had been trying everything I knew in my clinical repertoire since I had been practicing therapy since 1950, and nothing resulted in this. I got her so to the point where she could sit by the pool, dangle her feet in the water, but it was sheer torture for this poor woman. So although it looked like an improvement, and a lot of behavioral therapy will report improvements like this in behavior, the way I characterized this change that she could sit there is that all she learned was that she could take more misery than she thought she could before treatment. So she learned she could take more misery, but the problem was still there, and so were the nightmares. So we're going to show you a clip of Mary interviewed 17 years after treatment, because even to this day now, there's no trace of this problem anymore. The nightmares stopped immediately. Now, of course, I started trying this on all my other patients with fears and phobias, and alas, I did not get the same dramatic results. So I had to learn a lot more.
You know, everyone is frightened of something, but for some people, fear becomes a way of life. For these people, the fear of things like spiders, heights, and water, it becomes so intense that they can't live a normal life.
Our first guest says he's developed a 5-minute cure for most phobias, and he's here to prove it works. Please welcome clinical psychologist Dr. Roger Callahan and a former patient, Mary Ford.
Hi, Mary. Thank you for being here.
Pleasure to have you two on the show today.
It's a pleasure to be here. Now, for those of us who don't know, what is a phobia?
Phobia is a very severe fear. It's constant. It's there all the time. If you avoid the phobic situation, you can feel fine. But when you're confronted with the fear, then it can be very, very upsetting.
It's an irrational fear?
Yeah.
So they rationally...
The patient knows that.
They know that,
it doesn't
but somehow
help.
Emotionally
Oh.
it
doesn't
make
help
sense
one iota to know that.
Well, Mary, I know you have a fear, or had an overwhelming fear of water.
Yes, I did.
How did that affect your life?
Oh, it taken complete control of my life. I mean, I couldn't be around any kind of water mostly. Big bodies of water, rain, anything like that. I just...
Even on television.
And on television. I could watch it on television. I get up just almost a nervous wreck.
Well, how about cooking? I
or
mean, or drinking
dishes.
water?
Well, I drink, but I don't drink that much water. And somebody asked me, don't you take baths? Yeah, but they barely come over my feet. So I don't know where the fear come from. It's something I must have been born with.
How did you help Mary?
Well, first, I worked with her for 1.5 years using the conventional therapeutic procedures that I had been using since 1950. I've been in the field for many, many years. So I kept searching and developing, and I finally hit on something that's so absurdly ridiculous as it looks back on it now, but it performed a miracle for Mary. She was cured in an instant, just like that.
In an instant?
Yeah.
Do you remember that instant?
Oh, yes, I do. I just felt like a big load had lifted up off of me.
And there was a storm that night.
And that was a very bad storm. You know, usually when the storm here in Los Angeles, the streets get like rivers. Well,
oh, yeah.
And I usually had to come over cold water, and you meet all this muddy water coming down. I called Dr. Callahan, telling him, don't look for me, I'm not coming. So that night, though, after I went to the pool, and I said, I know this fear going to come back. So I said, I'm going to the beach. If the beach don't do it, I'm cured. So I went to the beach at night, and I walked on the thing, and and it never has returned.
Well, Mary,
I'm so glad that you're over it.
It's
But don't
incredible.
quit Waterworld, honey.
No.
It's not worth it.
it's not worth it. Thank you for coming on the
Yeah.
show today.
Of course, the treatment of Mary was a milestone. And although all my other clients did not respond in the same way, I was very fortunate that Mary did with that simple little treatment, doing nothing more than just tapping under her eye, cured her, whereas nothing else came close to even making any difference whatsoever in this fear. Eliminated the nightmares and gave me the feeling, hey, this is something's going on here, because I've never seen anything like this in my whole career. And I've been doing psychotherapy since 1950, and I never even saw a demonstration. I was a fellow of the American Society of Clinical Hypnosis, for example. I never saw anything like this. I never saw anyone do a demonstration like this. So I felt I was onto something, and I kept exploring and trying things and working. And over a period of years, we ended up finding a number of things through accurate, objective diagnosis that would help us develop treatments which are the most powerful treatments in the history of psychotherapy.